Welcome back. Eisenhower's Lucy Curci Cancer Center has been offering free lectures on breast cancer related topics this month. October is Breast Cancer Awareness Month. Next week, a board certified medical oncologist, Dr. Manasa Valchi, right here is going to be discussing triple negative breast cancer. Thanks so much for joining us.
Thanks for having me
today.
here.
Triple negative breast cancer is different, I guess, than other forms of breast cancer?
Yeah, so triple negative is a rarer type of breast cancer.
Okay.
Accounts for about 10 to 15% of all breast cancers.
So it's a small number.
It's a small number.
But certainly you need to be able to treat all of these different types.
Correct, yeah. The reason we call it triple negative is breast cancer cells can express receptors on the cancer cell called estrogen receptor, progesterone receptor, and HER2 or HER2. We can use those receptors as targets for treatment, but triple negative breast cancers don't express all three of those receptors, which is why we call it triple negative.
Okay, now who is most likely to come down with this type of cancer diagnosis?
Yeah, so anybody can get triple negative breast cancer,
Okay.
but it's more common in younger women and also more common in people with certain type of genetic mutations like BRCA1.
Okay, so it's a different type of cancer then. I imagine the treatments for this would be different than traditional cancers?
Correct, yeah.
How so?
For our estrogen-driven breast cancers or HER2-positive breast cancers, we can use targeted treatments like hormone blockers or HER2-targeted treatments. But because triple-negative cancers don't have those receptors, traditionally we've only been able to use chemotherapy for these types of cancers. Radiation and surgery are options as well, but now we have more exciting newer drugs available to treat these cancers in addition to chemotherapy.
It's amazing some of the advances in medical science. So you're saying there's some new treatments that are available, some new medications that can help and people give them a better shot at recovery. What about the research into this breast cancer?
We have a lot of advances happening in the triple negative breast cancer space. Now we're looking into immunotherapy, which are newer treatments that help train our immune system to fight the cancer. We also have newer type of drugs called antibody drug conjugates, where we package chemotherapy into a monoclonal antibody or a target, which goes and sits on the cancer cell and destroys the cancer cell in a very sophisticated manner.
Wow, isn't that amazing?
Yeah.
It's obviously a very interesting, intricate topic, and if you want to find out more, you can hear more about this. You're going to be giving a lecture on this Monday, the 30th. It's from noon to 1 at the Eisenhower Lucy Curci Cancer Center. You can go to eisenhowerhealth.org/calendar for more details. Thank you, Dr. Manasa Valchi. I appreciate you joining us here on News Channel 3 today at noon and letting people know about this upcoming presentation. Thank you so much.
Thanks for having me.
It's great to have you here.